Hello, I am Andrea Cooley, one of the owners of Des Moines Mom, and today we are excited to continue our mental health series. We are talking with Sheila Russell, who is a licensed independent social worker and an EMDR certified therapist. And she's going to be telling us about EMDR therapy today. Maybe it is something that you've heard of, or maybe it is something that is completely new to you, but we're excited to learn more about it today. So thank you for being with us today, Sheila.
Hi, thank you so much for having me.
So tell us, what is EMDR therapy?
Yes. So EMDR stands for eye movement desensitization and reprocessing. And this is a type of mental health therapy that both works with the brain as well as with the body. And it is most notably known for helping to resolve trauma and or post-traumatic stress disorder, so PTSD. And in addition to that, EMDR can be extremely effective for all types of mental health conditions or stress or challenges that people are experiencing, both past and present.
Okay. I mean, it sounds very beneficial. Can you explain a little bit what it is, or what someone would, what the process would be?
Sure. So when somebody would come in to start EMDR therapy with a provider, essentially the first few sessions would be spent on getting to know each other, history taking, very traditional to other forms of therapy. However, EMDR is different than things like talk therapy or other modalities that are really well known in therapy, might be cognitive behavioral therapy, CBT, DBT can also be pretty common. EMDR is different than those components, however, because where we move into with the EMDR is then we're moving into an 8-stage type of therapy. And the first few stages are all on coping strategies. And we want to help give people tools to be able to cope with and deal with the ability to kind of get into the deeper, more rooted work. And so after we get through some of those coping stages, then where EMDR really differentiates from additional types of therapy modalities is the sense that we are going at things that are troublesome or bothersome or have been traumatic. And we're really helping the brain and the body to be able to resolve and heal those components. And that is very different than your traditional talk therapy because we're helping a part of the brain heal that we cannot talk out of, like can't talk to with our normal language.
That's so interesting. Is this something that is just for adults, or can kids, go through this therapy as well? I think, we have our audience of moms, and they, may have experienced some trauma, but their kiddos may have as well.
Absolutely. So yes, EMDR is both for adults as well as for kids, and we use different approaches depending on the age range of the person that we're working with. But certainly it can be extremely effective for adults as well as children.
All right. So you talked a little bit that this is beneficial, for someone who maybe has PTSD or trauma. Can you give any, examples of, maybe someone is seeing, habits in a child, or has experienced something, where maybe this kind of therapy would be beneficial?
Sure. Yes. So again, EMDR is most well known for being able to heal PTSD.
Mhm.
And additionally, it can be effective for all forms of mental health conditions. So I might see somebody who has generalized anxiety disorder, or one of my colleagues might work with somebody, whether adult or child, who has some depressive symptoms. And so it doesn't have to be just trauma. But in addition to that, we tend to see symptoms differently in adults versus what we might see in kids. And let's say that we're comparing trauma seen in an adult versus a child. For trauma seen in an adult, or stressful trauma seen in an adult, we might be looking for things like internalizing. or withdrawing, or I really struggle to get out of bed, or I'm having challenges functioning in my day-to-day life. Versus kids, we would be more likely to see outbursts in emotions, right? Their emotional brains are developing and it's already a hard enough time to feel feelings. But when they have really big feelings, we have lots of outbursts and over the top outbursts. For kids, we might also be seeing bedwetting at an age where that's already a stage that they've kind of conquered. So we might see some regression there. And so the symptoms can just look very different, but effectiveness nonetheless.
Yeah, no, that's fascinating. So I think the next question would be is it this something that you just do in an office? Is it, is there something like tangible that, the patient or the therapist is doing? When I hear eye movement, I think, I don't know, is it a dark room? Are you doing something to my eyes?
Sure. Yes. So I kind of like joke about the sense of, this is definitely different than what people have experienced if they have not engaged in EMDR before. But the research and the science completely back it. In fact, a lot of my population that I specialize working with is actually with first responders and military. And the Department of Veterans Affairs actually states that EMDR is one of the most effective therapy modalities that we can use. So yes, that's not stated lightly. The research backs this for sure. And what it is that we either as a therapist, we might use eye movements, or we might use these things that are called tappers or buzzies that somebody holds in their hands, or for a kiddo, we might put the buzzies below their legs or in their shoes. The buzzies give different vibrations, and that allows for what's called bilateral stimulation. Another therapist might use a light bar. Somebody might use tones, so sounds on a headphone that a client would wear. And so there are different ways to be able to access this bilateral stimulation. And that's a way as to how it is that we're able to get to and heal whatever it is that's going on.
Yeah, that's so fascinating. So it's totally non-invasive.
Right.
And it's something that you're just doing in an office.
Yes.
And I know this is something that you are certified in. Is it, how would somebody find a therapist who practices this? And we
Sure.
can list maybe some resources for families as well.
Absolutely. So yes, certainly with that is that, definitely we have options of word of mouth. The Des Moines Moms Facebook website is great in the sense of being able to assist with resources. Also, of course, Google. And then in addition to that, there is a website that is EMDRIA.
Okay.
And what EMDRIA is that it is a global website that is available if you're looking for a specific EMDR therapist in a specific area. And so that's a resource as well.
Okay. Well, thank you so much, Sheila. I think, I learned a lot about what EMDR therapy is and how it works and how, both parents and kids can benefit from it. So thank you very much. We appreciate your time today.
Thank you.